for bringing me here all the way from Canada, cold Canada, to a warm and not too hot Saudi Arabia. These are my disclosures. What you see here is from the 8th Intermax report, and you see the overall survival after LVAD or BiVAD implantation. That means destination therapy or bridge to transplantation, all implants together. And what you see that the last 2 years, you see that there is no improvement of survival anymore. The survival is around 73 to 75% at 2 years. And the reason why there is no improvement is, of course, because we still have to face the death due to adverse events. And the most adverse events are, as you already mentioned earlier today and yesterday, are neurological, strokes, and mainly multi-organ failure, infection, device malfunction, and right heart failure. And 3 of them are directly related to the mechanical properties of the pumps. And these pumps are, these are the survival rates you saw in the previous slide of since we introduced the continuous flow pumps. So actually, they are mainly about the HeartMate 2 and the HVAD. Well, if you want to do something, if you want to increase survival, we have to do something about these mechanical properties. We have to do something about the mechanical properties causing these adverse events. And that is only possible when we make our devices more hemocompatible. Hemocompatible means that you minimize the shear stress, so there is no damage of the blood cells. You minimize stasis, so there is no clot formation in the pump. You minimize flow patterns, that minimize activation of components, and you minimize the interaction between blood and the contacting surfaces. And this is exactly what the developers of the HeartMate 3 had in mind when they created this pump. It's a pump, it's a centrifugal flow pump, fully magnetically levitated, and engineered to minimize destruction of red blood cells and thrombosis. And this is done, first of all, by wide blood flow passages to reduce shear stress. So the space, the compartments around the impeller are almost 20 times bigger than of other centrifugal pumps. The pump is frictionless because there are no bearings, mechanical bearings, because of the magnetically levitation. And there is an intrinsic pulse designed to reduce stasis and to avert thrombosis. To prove that this design is working, the company and hospital started to create a study called Momentum, the Momentum 3 trial. And the Momentum 3 trial is a randomized study where in a one-to-one fashion, the HeartMate 2 and the HeartMate 3 are implanted in 366 patients with a 24-month of follow-up. Here you see that in the HeartMate 3 arm, there were 190 patients. In the HeartMate 2, 176. And finally, we ended up with, in the treated population, with 189 HeartMate 3s and 172 HeartMate 2s. The primary endpoint of the study was survival at 2 years free of disabling stroke, and disabling stroke was indicated by a modified ranking score more than 3, or survival or operation to replace or remove the pump other than recovery. And the intention of the study was to demonstrate the non-inferiority of the HeartMate 3 LVAS to the HeartMate 2. And this was acquired by, and this non-inferiority was met if the lower 95% confidence bound for difference in the primary endpoint success at 2 years between the treatment arms is more than -10%. And sequentially, if this non-inferiority analysis has been met, we can do a sequential superiority testing as well. There were also secondary endpoints that included the frequency of adverse events such as stroke, bleeding, right heart failure, and infections, actuarial survival, and functional status and quality of life. If we look at the actual all-cause survival, then you see actually that there is after 2 years, there is a indicated difference in survival in favor of the HeartMate 3. However, this difference doesn't reach statistically significance with a hazard ratio of 0.71 and a p of 0.16. Are we looking at the primary endpoint analysis, however, then you see that the survival of 2 years free of disabling stroke or reoperation to replace or remove the pump, you see at 2 years, and already starting at 1 year, at 2 years there is a statistically significant difference in reaching this primary endpoint of almost 78% for the HeartMate 3 and 56% for the HeartMate 2. And if you do the non-inferiority analysis, and you see that the absolute difference is plus 19.2%, which means that with a p-value of lower than 0.001, this non-inferiority analysis has been met. So we can do the superiority analysis, and also the superiority analysis, the hazard ratio of 0.46 has been met. So in other words, the pump is not inferior, the HeartMate 3 is not inferior to the HeartMate 2, it is even superior to the HeartMate 2. And this difference between two pumps is mainly because of the freedom for reoperation to replace or remove the pump. And you see it here, if you see the freedom of reoperation or replacement for the centrifugal pump is almost 100%. It's 97.2% at 2 years, while for the HeartMate 2 it is 75.5%. And with a hazard ratio of 0.1 and a p-value of minus or less than 0.301, this is highly statistically significant. So this is one of the main reasons why you see that the superiority and of the centrifugal of the HeartMate 3 has been met over the HeartMate 2. And this is mainly the result that the HeartMate 3 almost shows no pump thrombosis. At 2 years, the freedom of pump thrombosis is almost 99%, and in comparison for the HeartMate 2 it is 81.4%, again highly statistically significant. So this is about the primary endpoint of the study, which has been met. But there are other points in the secondary endpoint, and one of them is stroke. If you look at stroke, then actually there is one striking fact, that is the freedom of all stroke. If you look again, the patients with freedom of all stroke, and that at 2 years for the centrifugal pump, for the HeartMate 3, it's almost 90%. In contrast to the axial flow pump, which is 76%. And again, this is highly statistically significant difference. This is from a study from Pablo Colombo, is recently published, and you see that this difference is mainly occurring on the long term. You see that in the perioperative stroke rate, or the short-term stroke rate, is not statistically significant for both pumps, but it starts to be statistically significant in the after half a year. So on the long term, this difference becomes manifest. If you go a little bit deeper into this stroke, then you see here that freedom from disabling stroke actually is for both pumps not different. In contrast to non-disabling stroke, as seen here, that is highly, at 2 years, highly statistically significant in favor of the HeartMate 3. Well, you should say, Actually, I'm more interested in the disabling stroke, because that is really devastating to your patients. And well, if there is a non-disabling stroke, it is bad luck, but we can live with it. Actually, we should see another result of this study. This is the survival post-stroke, all stroke, and you see, and all these patients, and you see that despite the fact that whether it is disabling or non-disabling, at 12 months, so after 1 year, the mortality is already 45%. So it is very important that stroke, not only disabling stroke, but you have to avoid non-disabling stroke as well to have a better survival. Are we looking a little bit further in this phenomenon, then you see that if in green in this graphic that is the survival without any stroke, and blue it is stroke, the non-disabling stroke, and in red it is the disabling stroke. And see, there is a statistically significant difference between patients who have in survival who have no stroke compared to the people who have a stroke. But again, at 2 years, there is no difference in the two stroke or non-stroke groups, and both are statistically significant, different from the non-stroke patients. And again, if you look at the severity of stroke, you see the same phenomenon. And it already starts. This is the post-stroke survival between ischemic or hemorrhagic stroke, or the post-stroke survival in C between non-disabling and disabling stroke. And you see already that after 1 year, there is no statistically significant difference anymore in survival. So it is very important that you should avoid stroke at any time. Well, other adverse events are bleeding, for instance, and we all are always really caught by the gastrointestinal bleedings. And unfortunately, you see that there is, between the HeartMate 3 and the HeartMate 2, there is no statistically significant difference, especially not in the GI tract bleedings. In both groups, it is 27%. And this is a little bit strange, because we know that these, especially the GI bleedings, are the result of AV malformation. But we know from a study that it is also important that the AV malformations are, the bleeding intensity is aggravated by the fact that the von Willebrand factor is decreasing because of the high shear stresses, and the HeartMate 3 shows that there is less damage to the von Willebrand factor in the HeartMate 3 when you compare it to the HeartMate 2. And you see it here. This is from a study from Ivan Netuka. You see that at baseline in blue, and in the HeartMate 2, and in red, the HeartMate 3, they are both on 100%. And you already see that after day 2, day 7, and day 30, and day 45, there is a statistically significant difference between the HeartMate 2 and the HeartMate 3. And the HeartMate 3, because of the lower shear stresses, is less damaging to the von Willebrand factor. And in another study from the patients in Prague and Brigham and a computer-assisted group, you see that the same phenomenon. So, despite the fact that the von Willebrand factor is preserved in many ways, there is still a high still a higher probability that you will have a bleeding problem. Well, with the bleeding, we know that it's the situation that we are always between a rock and a hard place regarding this. On one side we have anticoagulation, the rock, and we have on the other side we have bleeding, which is the hard place. You don't want to anticoagulate too high to prevent the bleeding, but if you have INRs on the low side, you have increase in the risk for oh, yeah. I cannot. I try to. Yep. There is a tendency for thromboembolism. So, in reality, we always try for different devices, but for the HeartMate 2 and the HeartMate 3, to keep the patient on an INR between 2 and 3. However, there's now a recent study in a small group of patients, again from Ivan Netuka, where they gave all patients a lower INR between 1.5 and 1.9. And the conclusion of the study was, it is a pilot study, it's a study with a low number of patients included. And the conclusion was that low intensity anticoagulation targeting an INR between 1.5 and 1.9 is achievable and safe with the HeartMate 3 cardiac pump in a short-term phase. The short-term means the 6 month post-implant. And that means that, and that's what we need in a larger study, but it is already an indication that we might in the future be able, with the HeartMate 3, to go to a lower INR, so to prevent probably the bleeding problem, or at least to diminish the bleeding problem. And last but not least, and this will this is for Dr. Tash, it also shows in a recent published study from Amanda Mira that in the 2 years outcome in the Momentum 3 trial, the economic analysis, the HeartMate 3 demonstrates a reduction in rehospitalizations, hospital days open spent during rehospitalization, and a significant cost saving following discharge when compared with the HeartMate 2 LVAS, irrespective of the intended goal of therapy. So this might mean for the future also good news. Well, in summary, in this primary 2-year analysis of the ongoing Momentum 3 trial, it has been demonstrated that there is an incremental improvement in outcomes driven by a reduction in the need for reoperation for pump malfunction or replacement of the HeartMate 3. There were only 2 cases of suspected or confirmed pump thrombosis events with the HeartMate 3, 1.1%. This pump thrombosis is always a principal driver of pump exchange without the need to exchange the pump in this regard. Although there's no difference in the incidence of adverse events such as bleeding or infection complication between both devices, there is a statistically significant difference in the freedom from all stroke at 2 years. And the use of the HeartMate 3 is associated with lower stroke rates when compared to HeartMate 2, with 10.1% at 2 years, which comes to 1.04 events per patient year from 6 months to 2 years, or from 0.008 to 0.004 events per patient year from 6 months to 2 years. Any stroke resulting in significantly reduced survival at 2 years, regardless of stroke severity. So it's not important whether there is a disabling or a non-disabling stroke, or even regarding the subtype. And in a multivariate analysis, the HeartMate 3 implantation was the only independent predictor of lower stroke rates. So not the afterload reduction, not the mean arterial pressure or anticoagulation. Thank you.